Well, you'd think that people would understand the roles that take place in birth, in a hospital birth, and yet we don't. And this was confusing even in my generation. It's as though birth just happened to us as women. It was something that happened to us that we had no control over. So we went to the hospital where they, the birth professionals, did things to us, not always that we liked, not always in the time we wanted. And because fathers were coming in 1970 when I gave birth, fathers had a specific role because the childbirth preparation classes were skills based. So the Lamaze classes that I took with my husband, he timed contractions, he made certain I was ragdolly, he did some breathing with me, but he was very present. He was doing those things with me. He'd say to me, another contraction's going to come, and it's going to go away soon. And so he had a stopwatch, and he was doing all these things. The labor and delivery nurses at that point would come in every 4 hours, 2 to 4 hours, and they'd check me, they'd do assessments, they'd monitor. If they needed to do any procedures, they'd do them. And my husband would basically step back while they were doing those things. The obstetrician came in a few times and stood there and talked and wanted to know if I had any questions and gave his assessment of what was going on. And then when I was wheeled into theater, everybody was dressed in scrubs, and he delivered my baby, and they all oohed and awed over her. And then I saw him a few times after birth and went to a pediatrician for my daughter. So the reality was we kind of knew what our role was as birthing women. We knew we were doing this, but we really weren't entirely certain who was in charge. Our husbands were there to help us, but they weren't entirely certain how to navigate when birth professionals were around. So, one of the things that Birthing Better fathers and mothers started to work on when we developed the Birthing Better skills in the early 1970s, and they evolved over a 15-year period, hundreds of families who just nitpicked the Jesus out of everything. And one of the things we nitpicked was the relationship that we had with ourselves as birthing women, what happened when we didn't like things and our minds were giving us negative thoughts, what happened when they did things to us that interrupted the flow. A lot of personal stuff was going on, and we tried to use our skills back then. Our husbands, they stood aside when the birth professionals came in. Often they stopped helping us. Often we got thrown off our game when they started to do assessments. We didn't know. The obstetrician came in. Most of us stopped using skills to pay attention. We were active and passive. And so this is something that fathers and mothers and I discussed and worked on for years. We got better at it. We got better at it as we took more control over really seeing pregnancy as a time to learn skills to birth our baby. When we first developed the skills in the 70s, we were focused exclusively on how to cope and manage the natural occurring pain better for all births, because Lamaze and Bradley, as I've mentioned before, were really focused on low-risk normal births to achieve a natural birth of pain-free labor with no medical care. And that sort of threw us off because we knew in the back of our brain, if we didn't fit that criteria, that really the skills weren't meant for us. So a lot of us didn't apply the skills as deeply or as thoroughly as we could. Besides, the first global childbirth preparation skills of these three men were new, so the evolution of skills should have happened. And it didn't happen because the natural birth movement in the 80s said cows and cats aren't taught to birth, women don't need to be taught to birth, birth is instinctual, you don't need to be taught breathing skills, you breathe all the time, you'll breathe in labor. Women will know the best positions to get in. So we got retrained in our thinking under a new childbirth trend. And skills weren't taught anymore. Information was the name of the game. People got bored out of their gourds going to the classes. They didn't really have anything to do for themselves at home. And fewer families went into the hospital births being skilled. And so the roles got vaguer back then. You went in and you followed, we thought we followed the doctor's orders. Now you have all the choices in the world and you're following the doctor's orders because you don't have skills. And even back then when the birth plans started to come out and women had all these lists of a gazillion things. I mean, nobody understood what we really wanted, and we didn't understand what we wanted. I mean, I can't tell you how many thousands of women have told me I wrote an extensive birth plan and none of it mattered to me at the birth. Or I had 15 things that were really, really important, and it turned out a 16th thing that I didn't think of was. Or of those 15 things, only one was really important, but it was so tiny nobody really understood it. Or I really didn't care what happened. Or everything that I wrote down didn't happen, and I'm pissed off at all of it. I mean, birth plans were like a nightmare in the making, because there's no way to know what your birth's going to be like, and babies don't come to plan. So we can't plan them. We may know what we want. And what do women know about what we want at birth? We all want the same thing. We want a safe and healthy birth, and we want a positive experience. So how do you get the positive experience? In my generation, it was to use skills, and in the next generation, it was not to use skills and to make choices. And so we have to go back now and talk about what the birth roles are. In this lesson, you're going to find out more about it. It's the who and the what and the why. So you're going to the hospital as a choice. You may be pressured to go to the hospital, but you're going to the hospital because of a choice. And you're going to the hospital knowing that there's going to be assessments and monitoring and procedures, or what you call interventions. And you may be writing a birth plan to try to determine what you're going to do about those things. So you're trying to get in charge. You're trying to gain control. You're going into their environment. And you need to understand that in their environment, they have a lot more experience than you do. This is your birth. You're entitled to a safe and healthy birth, so to speak, maybe. And you're entitled to a positive birth, so to speak, maybe. So let's just get really clear how you achieve the positive birth part of it, and then we'll talk about the healthy part of it from a Birthing Better viewpoint. The positive birth it's not even remotely in the ballpark. Unskilled women, lucky if they have a good birth. Skilled women, 95% of those women will have a more positive birth than the unskilled women. And the 5% that don't, couldn't be shagged to use their skills. As simple as that. Couldn't be bothered. It's a common word. So if you want to have a positive birth, you have to use your skills. How long do you have to use your skills? From when your birth starts until your baby is born, and sometimes afterwards. Just because birth plans change, you don't like what's happening, it's not comfortable, you have negative thoughts about it, they did this or this didn't do it to you, are still birthing your baby. And you need to keep using your skills. Is that tough work? Yeah, sure it is. And that's why we have an ebook on the negative and positive voices. It's very simple to deal with this. It's hard work, but it's simple. We have negative thoughts all the time. If you're a parent, you know that, right? But you don't act on them. You put in place your better skills. Negative thoughts are still there. And this is one of the complications about, once again, the natural birth movement, telling women to only think positive thoughts or only listen to positive birth stories. First of all, we can't learn if we're only listening to the positive. Second of all, our birth isn't going to be anything like that. Third of all, we're not positive all the time in our life. It's not about being positive. It's learning how to deal with when we're not positive. And next, you can't teach your child to be positive all the time. That's never going to happen. And you're never going to be able to teach your relationship between you and your child to be positive all the time in your thinking or your actions. So what you want to do is to permit yourself to think whatever you want. Don't try to suppress any of it, and just develop skills. So if you're sitting there now pissed off at me, take a deep breath in, Calm yourself down, breathe out, and let go inside your pelvis. It's no different now than when you're giving birth. It's no different now than when you're dealing with a naughty child. It's no different now when you're not pleased with what your partner's doing, or your boss is doing, or your sister are doing, or your mother or father are doing, or the guy's driving the car next to you. So you've got to get realistic about this. Your job as a birthing woman is 100% of the time, nanosecond by nanosecond, to do the activity of birthing your baby. And you will do it better with skills that break down those nanoseconds. And it's simple. Your body is in some posture and position right now. Soften inside it. Right? You're breathing right now. As you breathe in, open inside your pelvis. And as you breathe out, soften inside your pelvis or any place that's tense. There you go. That's being in the now. And what's happening to you or around you is happening to you around you. And you are choosing in yourself to use skills right now to be here and be in the now. And that's what birth is like. So you're always doing the activity. That's your role. The role of your birth coach, or the person who's going to be with you, whether a male or a female, is to share the same set of skills with you. You do not want somebody to come in there and be your birth coach that you do not know the skills that they're using. It's confusing and it's irritating. All learn the same skills. You teach them. They don't teach you. It's your birth. You're an adult. You came into this as an adult. You're going to be expected to be a mother at the end of this as an adult. Be an adult in pregnancy, preparing for birth, and in birth. Be an adult. Use skills. Humans thrive on being skilled. You love being skilled. Become skilled to birth your baby. Use your skills. It can be hard work. You won't like a lot of it. Keep using your skills. Be determined. That's your job. It doesn't stop almost ever. You give birth and then you have to deal with a kid. So it doesn't stop. Keep using your skills. Birth coach, you're there to help her use the skills. You need to learn to see and hear when she needs help, because life is that long, pregnancy is that long, and birth is that long. She doesn't have 2 breast cycles to get out of control and to see if she's going to get back into control. You need to help her right away. And that's what you're going to learn in this course as well, how to see and hear right away. That's the birth journey that you're going to listen to, because the birth journey shows you contractions. Now, you can peel this off to an unplanned or emergency cesarean or an elective cesarean. You just don't often have as much stuff going on, so you can pay more attention to choosing to do this stuff. When you're in labor and you're having sensations internally and externally, then it's your behavior changes at a more rapid speed. So if you're in labor and in one inhale the pain's okay, and the next inhale it's gotten too much, your breathing and how you show it on your face is going to change. So as a birth coach, you're going to be able to see and hear those changes if you've been taught how. And it's simple. Basically, if your partner, let's talk about in labor or in anything. So extrapolate. Don't make me keep saying unplanned or planned. Okay. In birth, if the woman's face is fairly relaxed and her breathing seems fairly calm and focused, you don't know what she's thinking, but she's okay. Stay paying attention. If she starts to wrinkle her forehead or change her breathing, then respond with a skill, because she doesn't want to go down that path she's heading. She wants to stay in control. That's your job, number one job. Whether they come in and do dick, right? That's your job. While they're doing all their stuff, you get in her face and do it. Make her focus on you and let them do what they're going to do. That's your job. It doesn't vary. That's your job. Okay, that's your job. What are they going to do? They're going to do their job. Their job is to do the assessments, the monitoring, and procedures. They try to do it in a way that's okay for you. Are they right all the time? No. Are they wrong all the time? Who knows? Stop it. They have to do it. You don't have to like it. You probably won't like a lot of it. Your job as a birthing woman is to cope and manage when things that aren't pleasant are happening to and around you. And your job as a birth coach is to help her do that. This is no different than when you're a parent. It's really no different when you're in work. So, or in friendships or in relationships you have. Birth is just very compressed. So you need to use your skills on a moment-to-moment basis that we don't afford ourselves, with the exception of driving a car. So you don't want to space out driving a car because that puts you at a risk, and it makes you feel uncertain and unsteady when you wake up to the fact you've been spacing out. Birth is the same way. When women space out and don't use their skills, it's hard for them to get back in control. So the jobs are clear. Do the birth, help her do the birth, let them do whatever they are going to do, and you just keep using your skills and doing the birth, and you keep helping her do that. No more to say about that.